there's got to be a better way. There is. Okay, so with this one right over here, and as you saw, I like to do a lot of lever-based kind of techniques. And again, that's my wrestling background that likes to do that. So with this one right over here, it's just a way of being able to kind of engage thoracolumbar dysfunction as well as rib kind of dysfunction with a little bit more torque without having to put a lot more pressure with your cephalad kind of leading hand. So go ahead and bend your knees together right over here. Okay, so I make sure I have the knees together, bend the legs up. Now, depending on how high up I go, and this works really well for upper lumbar, all the way down, all the way up to roughly, usually about T4, T5-ish kind of region right over here. Okay, so if I feel like this is where I feel the most like paraspinal kind of hypertonicity right over here, I'm going to keep my hand right over here, and I'm going to try to bend his body so that I feel the arc pretty much right over here. Okay, so I'm going to get him right over here and bend his legs until I feel that I have that arc kind of created right over here. Then I'm going to bring my arms over here, keeping those knees and those legs together right here, and bend them down like this right over here. So I have a long lever and I have my short lever right over here. Okay, and so I can use this to enhance soft tissue just by doing this kind of motion. So kind of trying to couple it like this. If I can do muscle energy. So go ahead and try to contract your legs back up towards me right in this direction right over here. Okay, and relax, and then I can take it a little bit further. If I feel a posterior rib, I can kind of either use my thenar or hyperthenar eminence to be able to kind of thrust that back simultaneously with this. And then even from a myofascial standpoint, if I'm trying to kind of stack the planes, I can use this to kind of hit the plane a little bit differently to get a more efficient myofascial kind of thing. So you can use it for all sorts of different things, and you can use it for several different areas on here. And what's great about this is a lot of you guys are going to get done and you're not going to remember crap about how to kind of go about diagnosis. And what's great about this is all you have to do is, say, you know what, are there TART changes? Are there tissue texture changes? Is there asymmetry? Is there restriction of motion? Is there tenderness that they're feeling? I don't have to be a master diagnostician. I can just say, yeah, it hurts over here. Ouchie, we're going to treaty, bettery. Okay, just get them over here, and I can work on this here. And so it's a great technique just to be able to kind of loosen this tissue up over here. It's a great technique to be able to reduce that rib if you need to over here. And from a muscle energy standpoint, a lot of times you can get that tissue to really relax on yourself over here. Okay, so that's the leg lever. Now I use a very similar kind of adaptation to treat sacroiliac dysfunction. Go ahead and scooch back towards the middle right over here. Okay, so for sacroiliac dysfunction, I do unilateral leg lever, rather using both legs together. Now also from a contraindication for this thing, I always just double check, make sure it doesn't hurt their ankles, hips, knees, those joints that you're putting a little bit of stress across as you're doing it. Again, first do no harm. My dad's good. Okay, so I'm going to keep my hand just kind of stabilized across the sacrum right over here. I always purposely keep my fingers flailed up so they're not relaxing down into the danger zone over here. Okay, go ahead and bend this knee up right over here. Okay, so again, I make sure that knee's kind of wedged over here, and so I will do I'm keeping pressure on the sacrum while I'm helping to disarticulate the sacroiliac joint, and I can use it as a treatment to kind of get that sacroiliac joint as I kind of bring it through a range of motion right over here. And so this works really well for sacroiliac things. And so I'd only seen it in like one text as far as this being a test to check for sacroiliac dysfunction. It was called HIBS test, H-I-B-D-S. But from right here, it kind of gets the upper pole of the sacroiliac joint. From right over here, it kind of gets that lower pole of the sacroiliac joint. So it's one of the tests that I'll use just from an orthopedic examination, just to kind of see if that's, just one of the sacroiliac tests. I just double check and see if I think that's where the pain is coming from. But then I can just couple it right into a treatment for the sacroiliac joint. And so if I can either do articulatory, I can kind of bring it over here. If I feel the restriction right there, go ahead and try to push your ankle back towards the middle of the table right there. Okay, and then relax, and then I can take it a little bit further. And so it works really well from all those different kind of things, just to be able to kind of treat the sacroiliac joint. So again, try the unilateral sacroiliac leg lever, and then try the bilateral thoracolumbar kind of leg lever.